When we started all this, our blood pressure control rate was in the low 40%, which I believe was the national average at that time. It took us a while to get going, but after the first 3 months, it began to improve by about 3% per month. And our blood pressure control rate is now in the mid 70%, which is 90 percentile for HEDIS scores. So that translates to improved survival. That translates to more grandparents, which is really what I'm after, more grandparents. We would like to get the population management onto the dashboard of each of my clinicians' laptop computers, so they can see on a daily basis how well or how not so well they're doing in managing their patients' chronic disorders. If the number of red bars seems to be increasing, they better get moving to get things better, because that's their job. And I don't view this as the patient's job, I view this as our job, and we need to do this. 15 years ago, before we had any data to look at, we were working in the dark. Every man for himself, everyone believing that they had the best outcomes and were doing the best care for their patients. It took us the realization that the data showed to us that we weren't doing as well as we thought we were doing, and changes had to be made. And the changes are given to us clearly in the form of algorithms provided by highly respected, skilled experts in the field. We don't have to create our own algorithms, they're all there for us. It's very satisfying seeing those bars change from red to green. And once you hit all green, you know you've done a good piece of work. It's such an ideal, simple solution. It's visual, it's graphic, and it's a constant reminder. It's in your face. Here's where you are, here's where you need to be. Get there. Once you have hope that it can be achieved, it's energizing. I love what we're doing, and I walk into my waiting room and I see a bunch of patients, and I know I'm giving them darn good care. I know that because I can see it. I can see it on the graphs. I can see the green versus the red. I can see the numbers, which before I didn't know.